When we take this all together, the Korean phase 3 trial tells us that a low dose of 0.2 milligram daily dutasteride produces clinically visible gains versus placebo in 6 months with a placebo-like safety profile, and the Olson et al. 2006 paper tells us why a low dutasteride dose can still punch above its weight. The drug's dual isoenzyme inhibition yields scalp DHT reductions in the finasteride-like range at 0.1 milligram and also beyond, and with an even stronger push as you go higher to the 2.5 milligram range. Hey guys, and welcome back to yet another video. So today we're going to be looking at dutasteride and what is the theoretical minimal dose you can interact with while still keeping your hair and also potentially keeping side effects in check. Hey guys, before we continue this video, I would like to mention that we now have liposomal monoxidil sulfate on my website, folligens.com, FOLLIGENZ.com, and if the order queue is available and open, you can order it there. We're running it as a cosmetic. There are other sort of botanicals inside of this particular topical that are pretty helpful when it comes to conditioning the hair. So that's at folligens.com, FOLLIGENZ.com. That's FOLLIGENZ.com. Go check it out and maybe even try it out. See you there. So the title of the first study we're going to be looking at is titled, quote, Efficacy and Safety of Twice or Thrice, being 3 times, Weekly Dutasteride versus Daily Finasteride in Men with Androgenetic Alopecia, a randomized, investigator-blinded, active-controlled parallel group pilot study, unquote, by Penpanich et al. This study asked a focused question. If you give dutasteride intermittently, can you match or beat daily 1 milligram finasteride in men with androgenetic alopecia over 24 weeks? Well, in this study, we have 60 men aged 21 to 60, and they were randomized to either taking dutasteride 0.5 milligram twice weekly or dutasteride 0.5 milligram 3 times weekly. And then finally, finasteride 1 milligram daily. Efficacy was assessed using video dermoscopy for density and hair shaft diameter with a global photographic read as a sort of sanity check. Safety was tracked in parallel as well when it comes to these 3 drugs. So all 3 treatment interventions were efficacious and increased density and hair diameter from baseline, and the effect seemed to scale with the dutasteride dose across the intermittent arms. When it came to hair counts, the mean change in terminal hairs per centimeter square was about 7.7 hairs with the twice-weekly 0.5 milligram dutasteride dose, and 17.4 hairs with the thrice or 3 times weekly 0.5 milligram dutasteride dose. And when it came to the 1 milligram finasteride daily dose, it was 12.8 hairs. So here we can see, again, when it comes to the terminal hair density, 3 times a week 0.5 milligram dutasteride was the best. At second place, it was the 1 milligram daily finasteride. And then finally, at third place, it was the 0.5 milligram dutasteride twice weekly. On the global photographic assessment, and that's where they're looking at the entirety of the scalp, right? The moderate to marked improvement favored the 3 times weekly dutasteride group over the daily finasteride group. So 35% improvement for the 3 times dutasteride 0.5 milligram group, so 3 times a week, right? And 21% for the daily finasteride 1 milligram group. And when it came to safety, it was pretty much comparable across all groups. Every group had a similar safety or side effect profile. The investigators' bottom line was that both twice weekly and 3 times weekly dutasteride 0.5 milligram were effective and well tolerated. The 3 times weekly dutasteride 0.5 milligram dose outperformed the twice weekly, as we stated before, when it came to hair density and hair diameter, and produced global gains, while the hair count superiority over finasteride was really not statistically significant in this specific 24-week pilot study. So at the very least, dutasteride, when taken 3 times a week, is about as effective as finasteride 1 milligram daily in terms of hair count. And still, even twice a week dutasteride, where those doses are 0.5 milligram, still provides a significant amount of protection against androgenetic alopecia. So these signals of efficacy are very promising for people who don't want to commit to a daily dose of finasteride or even dutasteride, because you can get away with using dutasteride at 0.5 milligram twice weekly, and that will give you some sort of protection. We can also look at another study where a lower dose of dutasteride was used against placebo. The study titled, quote, Efficacy and Safety of Low-Dose Dutasteride 0.2 milligram for Male Androgenetic Alopecia, a multicenter randomized double-blind placebo-controlled parallel group phase 3 clinical trial, unquote, by Subin Lee et al., 2025. In this particular study, hospitals in Korea enrolled 139 men with typical male pattern hair loss and randomly assigned them under double-blind conditions. They would either take 0.2 milligram dutasteride daily, placebo, and finally the third group being the 0.5 milligram dutasteride every day. And this study went on for 24 weeks, about 6 months or half a year. So we have 3 arms in this study. We have the conventional 0.5 milligram daily dutasteride dose. We even have the lower dose, the 0.2 milligram daily dutasteride dose. And then finally, that's being compared against placebo. So it's a very, very good methodology, and we're going to get some really good data. Now, the main thing the researchers measured was the change in hair count inside a precisely marked 1 square centimeter circle at the vertex of the scalp. They also tracked the changes in the average thickness of the 5 thickest hairs in that circle, and then went on to have investigators and an independent panel score the standardized photographs. And then finally, they asked the participants in a survey how they felt about their hair. They also did some blood work to look at testosterone and DHT. Safety checks and side effect monitoring ran the whole length of the study as well. Well, at the end of the study, being week 24, the 0.2 milligram dutasteride group showed a statistically significant superiority over placebo on the primary endpoint, and that is the mean increase in target area hair count. Here, for the 0.2 milligram dutasteride daily dose, that increase was 22.38 hairs per centimeter squared. Again, that was with the 0.2 milligram dutasteride daily. When comparing this against placebo, placebo only had an increase of 5.09 hairs. And then finally, in the dutasteride 0.5 milligram daily group, the increase was 15.86 hairs. So more or less, the 0.2 milligram dutasteride daily performed about the same as the 0.5 milligram dutasteride daily dose when it comes to the change in the target area hair count. So let's have a look at blood work. Dutasteride at 0.2 milligram per day lowered serum DHT starting by week 12 and kept it low through week 24, without meaningfully changing testosterone by the end of the study. Testosterone, however, did increase versus placebo at week 12, but that difference wasn't statistically meaningful at week 24. So, in other words, this means that testosterone levels eventually normalized to fall in line with placebo. So the testosterone levels are pretty much in a normal physiological range. And of course, for the 0.5 milligram dutasteride group, the DHT decreased substantially. So it looks like, of course, the reduction to DHT will be dose dependent. And yeah, that pretty much falls in line with what we can see in the literature. But in this study, there's some approximations that have to be accounted for. So the DHT fell from baseline by 25 to 31%, which is kind of weird because typically you would expect for DHT, at least on dutasteride, to fall by somewhere around, somewhere between 80 to 90%. So this is kind of like a bit of an outlier. Now, there are some things that can potentially impact the readout here when it comes to the blood work. So maybe they used an immunoassay, which is less specific, instead of using LC-MS or MS, that's light chromatography, mass spectrometry or mass spectrometry, sort of machine to assess the amount of DHT that's going to be inside of the blood. So that sort of criteria that they used can include cross-reactivity and make the suppression look smaller than it actually is. And in this context, cross-reactivity means that the DHT test, if it's an antibody-based immunoassay, is not perfectly specific to DHT. These tests typically use an antibody, and these are specialized proteins that bind to sites called antigens. And antigens, these are substances that can trigger an immunoresponse. So even hormones themselves have antigens. And that's how the immunoassay can be used to kind of find out what hormones you have in your blood. So really, depending on what tests they used, it can kind of impact the drop that we're seeing. But conventionally speaking, when they use the LC-MS or MS, that being the liquid chromatography tandem mass spectrometry, it typically shows a decline in DHT between 80 to 90% when you're using 0.5 milligram of dutasteride daily. Now, later on, we're going to visit a study that concerns this. It's going to be the Olsen et al. Study, but let's finish up with the findings of this specific study of the 0.2 milligram versus the 0.5 milligram versus placebo study. So we're going to be looking at the side effects, and the side effects were mostly mild at 0.2 milligram daily of dutasteride. It happened about as often as with placebo. Now, guys, remember, placebo isn't taking anything that's going to meaningfully mess with their biological markers, especially in this study's context where we're suppressing a specific hormone like DHT, and then ultimately elevating testosterone, which can possibly aromatize into estrogen. So if we are essentially finding out that between the placebo group and the 0.2 milligram dutasteride daily group, that they virtually had the same rate of adverse profiles, even drug-related adverse effects or side effects, that essentially means that the 0.2 milligram dutasteride group is falling in line with the general population. Now, of course, there are factors like the sample size. Maybe a bigger sample size can possibly show a deviation between the groups, or maybe it won't. And there have been some studies where we've looked at like 19,000 people in a retrospective study, and it didn't really show any meaningful differences between two groups, but I'm not going to get too deep into that. Let's just look at this study over here. So when it comes to any side effect that's reported, whether drug-related or not, it was reported 21.8% on placebo, so that's 12 out of 55 people, 16.1% on 0.2 milligram, so 9 out of 56, and 28.6% on the 0.5 milligram dutasteride daily group, so about 8 out of 28. So right away, what we can notice is that the 0.2 milligram group actually had lower reported side effects of any kind, whether drug-related or not. And then second to that would be the placebo group, and then third being the most prevalent, reported side effects of any kind, being the 0.5 milligram dutasteride group at a rate of 28.6%. Now, when we're talking about the drug-related side effects, 10.9% in placebo, so that's 6 out of 55, 7.1% in the 0.2 milligram dutasteride daily group, so that's 4 out of 56, and 21.4% for the 0.5 milligram dutasteride daily group, which is 6 out of 28. When it comes to erectile dysfunction, it was noted in 7.3% for the placebo group, which is 4 out of 55, 3.6% for the 0.2 milligram dutasteride daily group, being 2 out of 56, and 14.3% for the 0.5 milligram dutasteride daily group, which is 4 out of 28. One of the people in the 0.5 milligram dutasteride daily group developed erectile dysfunction and left the study. When it comes to serious side effects, they were rare. 1.8% on the placebo group, which is 1 out of 55, 3.6% on the 0.2 milligram dutasteride daily group, which is 2 out of 56, and, strangely, none in the 0.5 milligram dutasteride daily group. Now, serious side effects, this does not mean that those side effects relate to dutasteride. Those are not related. Drug-related side effects That's the category we should be paying attention to, and maybe also the erectile dysfunction as well. But the other sort of things, like any reported side effect, again, that's just anything the patient or subject reports during the treatment intervention. So they could get hit by a car and literally report, well, I broke my leg because I got hit by a car, and that has to technically be included in the study, right? But overall, within the context of this study, we can see a trend where it seems as if, for whatever reason, the dutasteride daily group at 0.2 milligram, it has a lower side effect rate than the placebo group. And that kind of leads me to infer that some of the people in the placebo group could have been having a nocebo effect, where just knowing the side effects of a potential drug intervention may cause more psychological distress. And also, maybe they're kind of pissed off that their hair isn't getting any better. So that could also be a factor, right? They tell you, hey, you're going to be in a hair loss study, and then you realize your hair isn't getting better after 6 months. And that would fucking suck, to be honest. But overall, the 0.2 milligram dutasteride daily group looked effective for lowering DHT and improving hair counts over 24 weeks, with a very favorable side effect profile that's close to placebo and clearly lighter than the 0.5 milligram dutasteride daily group. So to review the efficacy here, just to put a little summary on this, 0.2 milligram dutasteride daily is about the same when it comes to hair counts and general hair improvements as 0.5 milligram dutasteride. And it also seems to have a better side effect profile. So for those people who are having issues with dutasteride or finasteride, 0.2 milligram dutasteride could be an option for you daily. Now, how are you going to get that? Don't ask me. I don't know how. Maybe I'll figure it out in the future for you guys, but it certainly is an option if you can get your hands on it. But this could mean something different in the long term. We don't have any long-term studies of 0.2 milligram dutasteride daily. We only know that 0.5 milligram dutasteride daily is effective. We have some long-term studies when it comes to that. And we're going to touch on that later, but if we look at the overall literature, again, just to return back to the point of DHT suppression, overall hair count improvements, etc., that lines up well with the Olson et al. 2006 paper titled, quote, "The Importance of Dual 5-Alpha Reductase Inhibition in the Treatment of Male Pattern Hair Loss, Results of a Randomized Placebo-Controlled Study of Dutasteride versus Finasteride," unquote. And this study really helps us make sense of these results. Olson's randomized study dosed dutasteride daily at 0.05, 0.1, 0.5, and 2.5 milligram dutasteride daily against finasteride at 5 milligram daily for 24 weeks. When it comes to the hair counts, there was a dose-dependent response with dutasteride. More dutasteride, more hair. Again, at least in these 6 months or 24 weeks of the study. You could possibly argue that, given enough time, maybe the 0.5 milligram group would have reached the 2.5 milligram group when it comes to both hair counts and maybe even scalp DHT. We just don't know. We also got some mechanistic data quantified when it comes to the shift of androgen levels in the tissue. When it comes to the scalp DHT, dutasteride suppressed DHT in a dose-dependent manner, from roughly a quarter with 0.05 milligram of dutasteride up to roughly 4/5, so about 80% with 2.5 milligram dutasteride. And with 0.5 milligram dutasteride, it's about 50% scalp DHT suppression. With finasteride 5 milligram per day and dutasteride 0.1 milligram per day, it landed in a sort of similar scalp DHT suppression band, so it's around maybe like 35%, so maybe 30 to 35%, I would say. And guys, that matters because as you suppress scalp DHT, you're going to improve your hair outcomes. So to put it in plain terms, once you're in the 0.1 to 0.2 milligram dutasteride neighborhood, you're already achieving scalp DHT suppression on par or better than what finasteride delivers at its approved doses, whether it's 1 milligram or 5 milligram. And just to note, 1 milligram and 5 milligram finasteride has the same systemic and tissue suppression of DHT. There's virtually no difference. But as you move up to 0.5 milligram dutasteride and to even 2.5 milligram dutasteride, you may potentially be suppressing that scalp DHT even more. But keep in mind, at 2.5 milligram dutasteride, that hasn't been studied long term, so you might be exposing yourself, perhaps needlessly, to a higher chance of getting side effects. We can also see in this study that the suppression of serum DHT was, again, in that sort of 80 to 90% ballpark. So when we take this all together, the Korean phase 3 trial tells us that a low dose of 0.2 milligram daily dutasteride produces clinically visible gains versus placebo in 6 months with a placebo-like safety profile. And the Olsen et al. 2006 paper tells us why a low dutasteride dose can still punch above its weight. The drug's dual isoenzyme inhibition yields scalp DHT reductions in the finasteride-like range at 0.1 milligram and also beyond, and with an even stronger push as you go higher to the 2.5 milligram range. But we also have to remember 0.2 milligram had a really, really good side effect profile. That has to be emphasized, and potentially even 0.1 milligram dutasteride would have an even better or similar side effect profile to 0.2 milligram. So if you can't tolerate 0.5 milligram oral dutasteride daily, consider using 0.1 or 0.2 milligram dutasteride daily, or consider using 0.5 milligram dutasteride twice a week, at the very least, 0.5 milligram dutasteride 3 times a week, at the very most, if you're having side effects, that is. So that's a really, really good study, and I'm happy that we have these sort of results. But like I said earlier, right, I keep having to reiterate myself because some people don't seem to understand this. We don't have any long-term studies here for 0.1, 0.2, or even that really low dose, 0.05, I think. So we can't make any long-term sort of distinctions. I don't really think long-term 0.2 milligram is going to fail. It could, but I can't say for sure. But I don't think it's going to fail. But that's why if you are sort of concerned and you're anxious about your hair and you don't want to risk anything, obviously you go with what has been studied the most, and that would be the 0.5 milligram daily. At least we have a 5-year long-term study on the 0.5 milligram daily where it showed long-term growth, safety, and general improvements from baseline. We actually have 2 more studies that we can refer to. The first being, quote, long-term effectiveness and safety of dutasteride versus finasteride in patients with male androgenetic alopecia in South Korea, a multicenter chart review study, unquote, by Choi et al. 2022. This was a multicenter retrospective chart review in South Korea that followed men with androgenetic alopecia for at least 3 years and assessed basic and specific pattern class changes, which is similar to the Norwood scale, just a bit more detailed. And it also looked at the adverse events as well. In this study, we have 600 adult men that were included, and in the on-label subgroup, 250 received dutasteride 0.5 milligram daily, and 285 received finasteride 1 milligram daily. Dutasteride showed greater effectiveness than finasteride on that basic and specific scale. Particularly, the basic and the basic M types seem to have a better response, and that kind of correlates with the typical Norwood, the regular Norwood-Hamilton recession scale. So it's really just looking at only hairline recession. The people who only had hairline recession and no crown thinning tended to do better with dutasteride. Adverse events were infrequent and similar or slightly lower with dutasteride, which is pretty impressive. Sexual events were rare and equivalent, and no serious events were reported with dutasteride. So, again, once more, that is a plus. The other study we can look at is titled, quote, long-term efficacy and safety of dutasteride in Korean men with androgenetic alopecia, 5-year follow-up data exhibiting clinical improvement with sustained efficacy, unquote, by Ji-Hoon Lim et al. 2023. And it found that after 5 years of 0.5 milligram dutasteride daily, 89.9% of subjects improved their hair loss conditions, whereas 93.9% of subjects at least maintained their hair, meaning they didn't lose anything. Sexual related side effects were the most common reported side effects, but they went away after 6 months of continuous use. So anyone out there who's having sort of libido issues or erectile dysfunction, this drug is going to change your hormones to some extent. So if you just stick on it, be consistent, eventually your body will adapt and those side effects will dissipate with time. And also, I already made a video on this before, so if you're interested, it will be in the description below, and it's probably currently playing on the screen right now. So that's pretty much it for this video. When you start using lower doses, though, you shouldn't have the full expectation that you're going to be protected long term. But my final takeaway point, and another initial point of reiterating, 0.2 milligram dutasteride daily is a real solution for those who don't want the sort of full commitment to taking dutasteride 0.5 milligram daily. But also, even at the very least, right? At the very least, you can just do 0.5 milligram dutasteride twice a week, and you're still going to be doing just as good, if not better than finasteride. And certainly, if you do 0.5 milligram dutasteride 3 times a week, you're going to get better than finasteride results. So that's pretty much it for this video. Thanks for watching. Hopefully I didn't reiterate too much, but again, some people, as these videos go on, they kind of just get the information mixed up and stuff like that. So I feel like it's pretty important. So anyway, thanks for watching, guys. I really appreciate you guys, and I hope to see you on the next video. Peace.